The next few segments are going to deal with breast enhancement. Breast enhancement involves the placement of a breast implant under the breast tissue. And currently in the United States, there are 2 available breast implants. There are 2 manufacturers of these breast implants. Both manufacturers put out a good product. The differences between the 2 companies' products is probably a lot less than the companies would like you to believe. First of the implants we're going to talk about are saline implants. Saline implants are basically a silicone shell, a solid silicone shell, filled with salt water. There's no coloring like there is in this implant. The reason I have coloring in this one is just for illustrative purposes so you can better see the implant. The saline implants have advantages and disadvantages just like all implants. There is no perfect implant. Saline implants have the advantage of being a little easier to put in because they're put in deflated and then filled after they've been put in the body. Saline implants have the advantage of being a little less expensive, and in these tough economic times, saving some money is important for some people. And saline implants have the advantage that when they leak, you develop a flat. Another advantage for saline implants is they can be put in through remote incision surgery, such as through the belly button or through the armpit. But we'll get to that a little later on a different segment. Now, the disadvantage of saline implants is that depending upon the thickness or thinness of the patient's tissue, you may feel the edges of the implant, which typically are the ripples that you'll feel in the implant. That's certainly more common in thin tissue patients. Another disadvantage of saline implants is sometimes these ripples are actually visible through the skin when you're leaning forward or on all fours. One of the last advantages of saline implants is that when the implant leaks, you develop a flat. So basically, saline implants, they've gotten the reputation as being a safe implant. Certainly, they are relatively safe. I've certainly seen implants removed from patients where the saline was contaminated prior to being added to the implant. So it's definitely not a perfect implant, but it's an implant that's preferred by a lot of plastic surgeons. The next implant we're going to talk about is silicone gel. Silicone gel breast implants got a lot of bad press in the early 90s, were restricted for several years, but were reintroduced back in 2006 for general use by the FDA with certain restrictions. Silicone gel breast implants have a solid silicone shell, just like saline implants, and they're filled with silicone gel. The disadvantages of silicone implants are basically silicone gel implants cost a little more, silicone gel implants have to be put in through a little bigger incision, and silicone implants, when they leak, and they will eventually leak, as do all implants, it's more work to clean out the gel. What's the advantage of silicone gel? Well, in my opinion, it's the gold standard for a natural look and feel. That, of course, is open to some degree of debate depending upon what plastic surgeon you talk to. But in my patient population, I certainly feel it's the most forgiving of the implants when it comes to a natural look and feel. One last implant that gets a lot of press but isn't used very often is the famous gummy bear implant. The gummy bear implant is an implant that also has a solid silicone shell. It's filled with also silicone gel, but this silicone gel is a lot thicker than regular silicone gel breast implants. That makes the gummy bear implant not ripple. That makes the gummy bear implant, if you were to cut it open, the gel would not go anywhere, which was the big advantage touted behind this implant, is that there's no gel migration. Well, the reality of things are, all silicone gel implants technically are kind of gummy bear implants. They all have cohesive gel. What differs between them is the degree of cohesiveness. The gel in this implant is not as thick and not as cohesive as the gel in this implant. The gel in this implant, technically upon rupture, could migrate, probably just locally, whereas this implant, the gel doesn't go anywhere. This implant has been touted as an implant that would be a lifetime implant, since even after the shell is degraded, the implant's intact because the gel maintains its shape. Whether or not that's true, we don't know, because these implants have not been around for 30 or 40 years, and I'm sure we'll learn a lot more about them as time goes on.